Welcome to this three-part series on harm reduction for healthcare. This final video will explore ways to integrate harm reduction into your policies and programs. Hopefully, by now, you're familiar with what harm reduction is, why it's an essential component of patient centered care, and a critical foundation to achieving health outcomes. What are the next steps? How should health centers begin to integrate harm reduction principles and practices into everyday interactions with patients? It begins with training, building effective partnerships, updating policies and procedures, and examining data. Let's look at training. All staff, including non clinical staff, should receive comprehensive training on types of substance use, harm reduction, motivational interviewing, and specific tools such as overdose prevention and response. It is critical that all staff are trained because a patient with active substance use disorder, especially those with multiple risk factors, such as housing instability, are already conditioned to have mistrust of healthcare workers and health systems. Creating a space where patients feel cared for and respected from the moment they initiate contact is absolutely essential to building that foundation of trust and ensuring an appointment is actually followed through. Training should also not be a one time occurrence. All staff should be trained regularly on harm reduction practices, and it should be part of any onboarding training of new staff. Next, let's consider partnerships. You may have already formed partnerships with social service organizations in your local community. However, have you looked into your local harm reduction providers or advocates as a potential partner? Does your state allow syringe exchange? What is your relationship with those providers? Can it be strengthened? There's an important distinction to be made between providing a resource directory or hanging a flyer to actually establishing a warm, connected relationship with those programs and their staff for referral purposes. Harm reduction outreach workers often make referrals for primary care, hepatitis C, HIV, sexually transmitted disease treatment, or wound care, and will try to avoid healthcare providers with reputations for maltreatment of substance users. Forming strong partnerships with those programs will go a long way towards breaking that perception. It allows for patients to see that a commitment to harm reduction is serious and promotes trust building. Policies and procedures. Does your organization have an overdose response policy in writing? Have staff received training in recognizing the signs of an overdose and how to effectively respond? Is naloxone readily available? Do staff know where it is located in the event of an overdose? Do your facilities have publicly accessible bathrooms? Injection drug users often use single bathrooms as a location for use, and unfortunately, it is a frequent location for overdose response. Harm reduction programs that provide bathroom access for clients will often have a policy that allows for safety checks after a period of time, or will utilize a sign in sheet to keep track of who is using the facility and for how long. Boston Healthcare for the Homeless uses reverse motion sensors in their bathrooms to detect potential overdose situations. If no movement is detected after a period of time, staff are alerted and a safety check is initiated. Given that substance use is among the most stigmatized conditions in healthcare, destigmatizing interventions starts with educational programs for all healthcare providers. Training should include certain terms to avoid and direction around the proper use of language and its role in promoting stigma. Think about the word addict versus words like substance user. Involving people with lived experience of drug use as partners in clinical care delivery and policy committees can also help to more fully address discrimination and stigma. These are some of the components to think about when drafting policies and procedures relating to harm reduction and serving individuals with substance use disorder. And finally, looking at data. Data plays a critical role in understanding patient populations and needs. If you haven't already done so, it is essential to conduct an analysis of patient data to determine a risk profile of your patients. How many have a history of substance use disorder? Housing instability? Are you gathering or tracking data on social determinants of health? In 2019, 70% of health centers reported collecting data on individual social risk factors, while 23% were in planning stages. As you look inward, you can also look outward. You are likely already conducting a community health needs assessment. What are the trends in your community that could be addressed using harm reduction? Is diabetes on the rise? Are overdoses increasing? Specific types of substance use being reported? It is not enough to simply capture data, but having a plan to how to analyze and respond is the most important next step. As we wrap up, we want to acknowledge the importance of taking the time to engage in these questions around harm reduction and patient care. Building a patient centered organizational culture rooted in harm reduction takes time, but will ultimately benefit both your patients and staff as you deliver care to the most vulnerable in your community.